All right. Let me look at you. My name is Eugene with Ethicon. We're going to in-service you guys on Vistaseal today. So I've got one of the boxes, one of the sizes. This actually is a size you don't have, but it's easier to demo off this size. But you guys have two sizes, a 2 ml and 4 ml. Vistaseal is a fibrin sealant that's used for bleeding and prevention of post-op bleeding. It contains thrombin and fibrin, and that's it. So it works independently of your patient's clotting cascade. So if people have been heparinized or people are on Levinox or they're on any sort of medicine that has impacted their hemostatic cascade and their ability to clot, Vistaseal is one of the best choices you can go to grab. It's an active hemostat component. All the other things that you have, including our products, except for surgical flow, are all passive hemoseals. They require hemostats. They require some portion of the clotting cascade on part of the patient in order for them to work appropriately. So, because surgical flow has thrombin, it works on the active side. That make sense? So this is what we have for you guys. This is really simple, but it's really can be a little bit confusing at first, which is why we wanted to do this. So you just get this out of the freezer. These are in the freezer in the very back. You guys have elected to tissue track them for now. That may change. It's not required. So because it's not required, there are no stickers when you fill out your tissue tracking. There's no extra stickers to put on your forms. You'll need to fill everything out manually. But maybe that'll change over time. It'll just depend on what the hospital decides to do. It's fine to track it. It's not a big deal. Two sizes, 2 ml, 4 ml. You just grab one out and then grab you some warm saline or water, it doesn't matter, on your way back. Put your new, fresh, warm water on your back table. Open the two components inside the box. There's two separate components. One is the dual applicator. We'll set that part aside at first. And this is the side that actually contains the components in the two syringes. It's just a dual syringe. You just enter these off. I would recommend passing them off and not dumping them off. So you hand them off to your back table. Waterproof lure locks are already in place. You just take this and drop it in the warm water. Watch the clock. 5 minutes, it should be thawed. You can confirm it's thawed because it'll be cloudy when it's frozen. It'll be completely clear, crystal clear when it's thawed out. Make sense? All right. In the interim, while that's thawing out, you can open your dual applicator. Be very careful. It's got this little peel pack part. So it has a place there for you guys to grab it off if you don't want to dump it. If you lose this part, you have to open a whole new device to get this part, okay? And that has already happened here. So just want to make sure that you have a hold of this. It has a couple pieces. It has the dual applicator piece, which is just this, and it has a couple extra tips, and I'll talk about the extra tips in just a minute. Once this is thawed, this is really simple. You're gonna untwist the waterproof lure locks, just like that. You're gonna take both components and you're just gonna snap them together. Now, I'm gonna recommend, this is so I can show the demo a couple times. Doesn't come with anything. Don't do this and do it. That has happened here also. And guess what happened? It went everywhere. That's right. So you could do it like this if this is easier for you, right? But I would make sure that you're standing over the table in case you drop this out of your hand. Either way, it just literally snaps together. Once it's snapped together, if you're doing an open case, it's ready to go, right? No need to prime, no need to flush air, no need to do anything like that. In fact, please don't do that. Because once the two liquids come across here and start to mix, they will start to clot almost immediately. They'll start to clot. It's thrombin and fibrin, the two active components needed for a clot, and it will clot really quickly, which is why you have extra tips. So if you accidentally hit this, or if it's you go to use it when you first try to use it and it doesn't want to come out, then you can change the tip. So you just twist the tip off, comes off really easy, and you've got extra tips. On the end right here, you can see there's the two little openings for the different components to come through. If there's a little, as Logan says, a little booger in there, just get you a little Raytech and grab hold of it and pull it away from there. So you're pulling out any clotted component that happened to get from side to side and started to clot the other side. Just pull it out, get your new tip, and open it up and go. Hand it to your surgery radio. Now, if they do this and they activate like this, it's going to spray. If they don't want to spray, they want to really control where they put it, you can take the tip off and you could just squirt it and dribble it on right. It's called the drip application, and you can just drip it right on where you want it to be. It'll still clot up just as fine. All right. Now, if you are using laparoscopically, still thaw it, still take it off, still pop it together like this. Then you're going to take the tip off of it. But the dual applicator piece has to go on there first. So to take the tip off, you're going to twist these lower locks. Now, really small, you probably can't see it. I don't know if you can see right here. It says Ethicon on both sides of this. So what we say is on to Ethicon. So by turning the knobs on, that would tighten it up. So to get it off, you turn it away from the on part on Ethicon and turn it a little bit on both sides, just a little bit at a time. If you're coordinated, you can do them both at the same time. It'll come off, go on the floor. Now, we have two laparoscopic tips. This is the rigid tip, and we don't have a demo flexible tip. This is 35 centimeters long. This is for straight laparoscopic cases where the surgeon's going to apply. The applicator part or the connection part is exactly the same. You just put this on like that, and then again, you're going on to Ethicon. So you would just twist your lure lock on, make sure it's on there good and tight. And now it's ready to go. The flexible tip is 45 centimeters long, and it would be used for robotics. So to use it for robotics, which is where Fields, who uses this, and he'll use it on almost all hysterectomies that he does. He'll use the flexible tip, and so you'll get it ready. You'll pass, whoever's assisting will pass it down the trocar. He'll grab the end of it with his robotic arm, and he'll tell you when to go, and you just spray till he tells you to stop. And he'll move it around because it's a nice flexible tube, and he'll move it around wherever he wants. Both laparoscopic tips also come with the tip that's on there and two additionals. So you have plenty. If you open the laparoscopic case, you'll have 6 tips total in case you clot or he says you start to go and he says, wait, just a second, you stop. And he wants to clean something up a little bit before he puts this on there. That tip is probably hosed at that point. It just takes really a few seconds of not spraying and it'll clot up, which is what you want. Take that off. Dr. Fields likes to wait 45 seconds. 4 minutes. He likes to wait 4 minutes after he puts it on before he'll say, okay, we're done and ready to go. He just wants to look at everything and make sure it's all good. It really starts to clot within 30 seconds, but it's up to, however, that's just his practice. That's how he's always done it at the other place where he's used this for several years. That's just sort of what he does. Okay, questions? It's pretty straightforward. We're going to leave it out. I would encourage you, if you're not someone who probably might be in a robot case, but you're not typically in a robot case, to come put your hands on it and play with it. First time you play with it, you don't want it to be in the case, because oftentimes, because it is it's an adjunctive hemostat, they could say, give me the Vistaseal because there's bleeding. It will stop bleeding. So you won't want to be under pressure when the first time you try it to try to put it all together and see what you think. Sound good? Questions at all? All right.
Yeah, you mentioned this probably should be counted pieces since it could come off.
Yeah, and so we have accounts that do that and accounts that don't do that. So it's whatever you guys decide you want to do, because these are small pieces. Come on. Because they're small pieces, they could get lost in the patient. So.
Moving out, room 3, please. Recovery, what day would you like us to come to?
All right. Good deal. Okay. Awesome.
Moving out.